Hey all, welcome to Share Trek. This is Raj here, and today I'm going to talk to you about a scientist. Maybe you have not heard about him. His name is Dr. Rama Rao Amara. Have you heard of Dr. Rama Rao Amara? He's an expert in developing vaccines to fight infectious diseases, and right now he's focusing on HIV/AIDS and trying to figure out how it works and how to stop it with vaccines and therapies. And I've reached out to Dr. Rama Rao a few times by email, but I have not heard back from him. Friends, the way it is that I have got my email as sharetrek@gmail.com. So probably my email to all these Tel Aviv and Exhibition and everything is probably directly going into the junk mail, and they're not looking at it. So anyway, our channel as it grows will be able to attract more people, and we'll be able to get them over. I was hoping to have an interview with Dr. Rama Rao, and that was supposed to be the first video of him on this channel. But I will continue to try reaching out to the good doctor. But in the meantime, I thought, why not showcase his work? I can do that without him having to be present. So let's get started. Welcome back, friends. Dr. Rama Rao was encouraged at a very early age by his father to become a doctor, and was always told that being a doctor was a noble profession and he could save lives. Though Dr. Rama Rao was keen to be a doctor, he ended up in biotechnology and has pursued his goal of saving lives from a very different angle in an even more effective way as a researcher. Dr. Amara got his PhD in molecular biology and immunology from the Indian Institute of Science in Bangalore, India. His research on the immune system's response to tuberculosis was so impressive that he won the Best Thesis for 1999 award. After that, he did his postdoctoral training with Dr. Harriet Robinson, who used to be in charge of the microbiology and immunology division at the Emory Primate Center. And Dr. Rama Rao is doing some really cool work in his lab these days. He's trying to create new vaccines to fight HIV using different combinations of DNA, MVA, and protein-based delivery platforms. I'll elaborate a little more on MVA and the delivery protein-based delivery platforms later in the video. Along with molecular adjuvants like CD40L and GM-CSF, he's making combinations, and he's even experimenting with oral vaccines using Lactococcus lactis, which is a type of probiotic. The goal is to create a vaccine that will build up strong mucosal immunity without the need of using needles. Dr. Rama Rao has already made some big strides in this area. He played a key role in developing an AIDS vaccine that has now gone through phase 2A clinical trials on humans, and he's not done yet. He's also working with other scientists in India to develop a vaccine that will work specifically for the strains of HIV that are most common in that part of the world. Dr. Rama Rao is making some serious progress in his research. He and his teams are working on developing vaccines to stop people from getting HIV in the first place, as well as treatments for people who are already infected. The new version of the vaccine he has created has been really promising in tests on primates. They were able to prevent HIV infection in 70% of the primates after they were exposed to the virus 6 times. These new vaccines use something called as adjuvant, which helps make the immune response stronger, and they are made using modified smallpox vaccine, modified smallpox virus called as MVA, which is really good at delivering HIV antigens. And Dr. Amara was even getting ready to start testing these vaccines on humans when the COVID-19 pandemic hit and slowed down everything. But even with COVID-19 throwing a wrench in the works, Dr. Amara and his team were still able to use the same platform to develop a vaccine for COVID-19, and in primate studies it showed a lot of potential. Dr. Rama Rao's earlier work developing DNA/MVA vaccines with his postdoctoral mentor, Professor Harriet Robinson, is offering a lot of hope for people with HIV. A recent study by GeoVax, a biotech company working with the HIV Vaccine Trials Network. The HIV Vaccine Trial Network is a government-funded group that conducts HIV vaccine trials, and it found that the vaccines are safe and generate the desired immune response in humans. The technology has been licensed to GeoVax by Emory University, where Dr. Amara works, and the company is now getting ready to start testing the vaccine's effectiveness. But Dr. Amara's laboratory is also working on a different approach to treating HIV-infected people. They have found that giving a vaccine to animals after they have been infected by HIV and treated with anti-HIV drugs can control the virus even after they stop taking the antiretroviral drugs. Dr. Amara's DNA/MVA vaccines are designed to take advantage of the immune system's ability to remember past infections. According to Amara, some immune cells have the ability to remember what they have seen before and can quickly respond to an infection they have encountered before. Dr. Amara's colleague, Professor Rafi Ahmed, is a world-renowned expert in this area and has done groundbreaking work on how these memory cells are formed. The vaccines contain fragments of HIV that trick the body into generating an immune response to the virus. When you become infected with a virus, your white blood cells start to divide and replicate themselves to create more soldiers to fight off the infection. Under normal conditions, the number of white blood cells in your body that can fight a particular infection could be as low as 1 in 10,000 or 100,000. Dr. Amara explains that if you do not have enough soldiers to counter the attack, the virus wins. But if you have more soldiers, the host wins. The vaccine helps the body prepare for a future attack by generating more immune cells that can act very quickly to kill the virus. Dr. Amara is aware that conducting efficacy trials in humans for phase 2b studies of HIV vaccine can be challenging due to the absence of a cure for the disease. In such trials, researchers vaccinate human subjects and then expose them to virus to evaluate the efficacy of the vaccine. However, the approach is more difficult with HIV since there is no cure. To overcome this challenge, clinical trials are conducted in areas where the transmission rate of HIV is high. And Dr. Amara plans to do exactly that. He plans to randomly vaccinate thousands of people in high transmission areas and compare the result to a group of individuals who receive placebos in the same area. The trial will be conducted over 3 years to observe the transmission rate in both groups. He believes that the vaccine group will show a dramatic reduction in transmission, making this method an effective solution to evaluate the efficacy of HIV vaccines. However, there are other challenges faced by HIV researchers as the virus is genetically diverse and different all over the world, making it difficult to develop a vaccine that is widely effective. Cynthia and Durden, professor of laboratory medicine and pathology at the University of Washington, emphasizes the importance of overcoming this diversity challenge and dealing with the different variants of the virus. Friends, I'll keep track of this evolving story and track this vaccine and see where it goes, and also provide you updates as and when they are available. And of course, I'm going to continue pestering the good doctor to give us an interview. So that's what I have got for you today. I hope you found something of interest and hope out here. And I'll be drilling down into some of those concepts that I spoke here, like MVS and all, and bring separate videos to you in future. But I have a long list of potential vaccines and therapies that I want to present before that. Most of these have not been shown in this channel before. So I'll give priority to that. And friends, that's all for the video now. I'll see you in the next video, and a special thanks to our Patreons, Inf, Jason, and Howard. Bye for now.